In the 20th century, Ivan Pavlov discovered classical conditioning with a bell, some meat powder, and a few dogs. Normally, food in a dog's mouth causes salivation. It's the unconditioned, unlearned, and reflexive response to the unconditioned stimulus. The sound of a bell alone usually doesn't cause salivation, so we call the bell the neutral stimulus that elicits no response. However, when Pavlov repeatedly paired the two stimuli together, the bell alone was able to cause salivation. The bell became the conditioned stimulus with a new conditioned response. We see the same conditioning in addiction to drugs like heroin, where environmental cues like where the drug is administered or the prep work for drug injection acts as a conditioned stimulus in developing tolerance against the drug. The environmental cues are able to prepare the body for the entry of the drug, and as the dosage increases, the body is able to prepare itself more beforehand. This increases tolerance. A paper published by Single shows that many deaths from heroin overdose aren't from overdoses at all, rather they're from the lack of normal environmental cues that the person is used to. If the addict is injecting the drug in an unfamiliar environment, there's no biological preparation of the body, which decreases tolerance. So when the drug enters the bloodstream, the body is unprepared and shocked by the extreme amount of heroin, resulting in death. But understanding the impact of environmental cues can also be used in as addiction treatment. When Pavlov rang the bell numerous times without food, eventually salivation no longer occurred and the behavior went extinct. Similarly, the therapy takes advantage of repeated exposure to the cues associated with addiction, location, sight, smell, etc., without the engaging in the addictive behavior. This unpairs the cue from the effect of the drug and makes it neutral again, reducing the power of the cue to cause craving. In conclusion, classical conditioning helps explain a common cause of drug overdoses and consequently has led to the development of therapies to reduce addiction. It plays such a big impact on our actions, and with this in mind, we can try to be more aware of what's influencing our behaviors.